feeling pretty good about these.
That's right.
I'm feeling really good about these.
I agree, and that's what we're doing. That's where we're finding deals, and our clients are benefiting from it.
You know what's interesting too? It takes those fossil fuels to make windmills. It takes those fossil fuels to make solar panels.
You got it.
All right? So as long as we need electricity to make these things that we're using to produce electricity, we got a home run here.
I don't see why not.
I don't see why not either. And again, we're not recommending this for everybody, but this is some of the stuff that we do. We like to set up income streams on investments where we're buying an income producing investment. And what a better deal than a bond where you know what your maturity date is, you know what your interest rate is, you know when you're going to get your interest paid to you.
You got it.
So,
and for our listeners who would like to sit down with us, themoneydocs.com. You can find us online with all our contact information, including our phone number, 1-800-584-0737, themoneydocs.com.
Yeah, we want to feel some love from you, Florida. So before I say adios, again, go to themoneydocs.com, request those worksheets, and we'll see you next week.
Chuck LaRocco of Commonwealth Financial Group is a registered representative, helping people reach their financial goals for over 25 years. The views expressed on this program are general in nature and not intended to be investment advice. Any discussion of individual security should not be construed as a recommendation or solicitation by the presenters. Securities offered through Cataract Grant and Company, Inc., member FINRA, SIPC. Commonwealth Financial and Cataract Grant are separate entities.
1230 WBZT West Palm Beach, an iHeartRadio station. This report is streamed live on our iHeartRadio app. Download it now.
A perfect Sunday afternoon is underway for Palm Beach County. The forecast calls for a mostly sunny sky and really nice temperatures. Highs near 74 degrees expected. Tonight, clear and comfortable. Lows getting down to 60. Highs near 80 degrees are likely by midweek, as well as another round of rain. I'm Storm Team 5 meteorologist Tyler Malden for 1230 WBZT.
This report is brought to you by Blue Horizon Casino Cruises. Start the new year with a big win from Blue Horizon Casino Cruise. Sailing daily from the Port of Palm Beach, $20 to sail, and get $20 free slot play. It's like sailing for free, dinner included. Free alcoholic beverages while gaming, craps, roulette, sportsbook, slots, and more. BlueHorizonCasino.com.
1230 WBZT. The thoughts and opinions expressed are those of the sponsor and don't necessarily reflect those of the station or iHeartMedia.
Hi, it's Leah, here to tell you about Dr. Anthony Pannozzo. He's a pain specialist located in southern Palm Beach County, so if you or somebody that you know is suffering in pain, Dr. Pannozzo is the one you guys need to call. And make that call today, because living in pain is no way to go through life. Dr. Pannozzo has been in practice now for more than 49 years. He's treated more than 73,000 patients for pain. He's an expert when it comes to diagnosing the pain, and he has had huge turnarounds. In fact, people living with scoliosis, he has had nearly a 100% turnaround. Lumbar pain as well. If you've got lower back pain, if you're suffering with migraines or flat feet pain, maybe pain in your elbows, your neck, your shoulders, Dr. Pannozzo can help you. And the greatest thing is he can help you without drugs, without surgery, and without having to go through weeks and months of rehabilitation. Give him a call today. Set up an appointment. It's 561-381-5800. Tune into his show Sundays, 11 to noon. And now, here's this week's edition of the Dr. Pannozzo Sports and Medicine Hour.
Hey, everybody. It's Les here, bringing you another informative show with Dr. Anthony Pannozzo. I want to first thank all those people in New York that are listening and requesting Dr. Pannozzo to get up there and move. But you got to understand one thing, folks.
And Atlanta.
And Atlanta. But New York and Atlanta are kicking butt. I can say butt, right? So first, let me introduce you our cast of characters. Number one, there's Carol, Connecticut. Hi, Carol, Connecticut. And there's Mr. S, which is Freddy S from amp2.tv. There's me, Les. And the most important person is sitting right next to me. Oh, it wasn't you. It was the guy that just walked by. It is Dr. Anthony Pannozzo. So, Doc, how you doing today?
Okay.
You feeling good?
Yeah, really.
Except for the sinus weather, right, buddy?
Yeah. Sinus weather, that's true.
I had a talk with somebody, and I want you to help me understand this. He had gone to a doctor to have massive back surgery done. Went and did the rehab afterwards like he was supposed to, I guess, the therapy and the pills and all the other stuff. And now he's going in for another surgery, but the doctor who did it doesn't want to do a second surgery, had to go somewhere else. Why is that?
Well, obviously he doesn't know what to do.
Okay.
So he's taking the easy way out, which is say go somewhere else.
What do you mean he doesn't want to do it?
He refuses to do that surgery.
Well, what was the first surgery?
First surgery was a complete back surgery. He had like a neck problem, and they had to go and do some back surgery.
So he has to go in again? Is that what
Yeah,
you're
it's still
saying?
bothering him.
Yeah.
Oh, so this is a repeat.
Yeah,
A repeater.
a repeater.
So the original surgeon doesn't want to do it again because he doesn't know what to do, obviously.
Well, now I got to ask you.
It's just.
I'm sorry.
what
I
is it?
apologize.
So what is it? It's scar tissue.
That's what they said. Now, let me ask you a question. Okay, this has always been bothering. When they do an MRI, they don't see scar tissue, correct?
No, you only see bone.
Okay, so if you see a bone is bad, you don't know if it's a scar tissue that's making that problem.
Well, they're interpreting.
Okay.
And they can't interpret because they have no knowledge of it. That's why we don't want to see MRIs that much.
So why would, the way this medical world is coming and so many advances are taking place, why do they still use an MRI?
Well, because that's all they know.
Would it be better to use what you use, a C-arm?
Well, it's not the C-arm. The film is a standing
Yeah.
picture. It's a standing X-ray we do, and it has a patent to it. So
Right.
there's a method and a technique and an interpretation from it. It's better than an MRI. That's why we don't get MRIs that much.
So-
So we can tell you where your pain is from the history. So it's phased in. So you come in, we talk about where your pain is, and I ask you specific questions about it. So that gives us an idea of where it is and why it is, and then we do your X-ray. Then we talk about the scenario. What is it? Here's why you have your pain. This is where it is. This is why it is, and this is what we can do about it. And then we offer you treatment for it. Okay, we'll say, well, you need 3 shots here, or 2 shots here, or something, to correct this piece there. And then we do it. And then there's 32 steps from the procedure room to where I usually mark the chart. And in that
You counted those steps, right?
Yes.
Okay.
And in that length of time, you will lose all your pain. And people will say, "What's that about possible?" It is possible. We do it every day, and I've been doing it.
And no one comes back with the same
It does
problem.
not come back at all. Once that pain's gone, it's gone for good. It does not come back. That doesn't say you're going to have another pain. So that's what happened to this guy, probably. Scar tissue, and probably in another place. But you see, the steroids we use soften scar tissue, so you don't need an operation. Operations cause more scar tissue, so you never want to do that. I mean, they're overselling the surgery bit.
So let me ask you another question. Does scar tissue ever come back in that same area once you give them that shot?
Nope. It
Okay.
does not.
Have you ever had somebody? I'm asking you different questions today, Doctor. I might have asked you before because
Ask
people,
away.
Because the people in New York and Atlanta keep writing questions that they.
Yeah,
So-
no, what you're hearing is true. There is no, they're going back on it.
Well, Freddie, in all your time knowing the doctor as much as I know the doctor, have you ever seen a patient that said it didn't work?
I have never met anybody.
No, it's amazing, isn't it?
Yeah, everybody has a different interpretation about what Dr. Pannozzo does. Partly because their level of pain has been different, or they've had to live under different circumstances.
Well, they don't listen quite good enough then, if that's the case, because there are many sources of a pain. We only go for the worst one of the day.
That's right.
That one is not there the next day. That doesn't say you don't have any pain at all. It's because the original pain is gone. Now we deal with the secondary pain.
That's amazing.
And it works just like that. I mean, we perfected this pretty good over the years, and we expect to have a 100% cure rate, which we do.
Which is very funny about something else. You find out all these things when you're playing golf with the same group of guys. All of a sudden, something comes up. A guy has a back pain. They talk about it. So one of the guys suffers from very bad migraines, and he's gone for Botox. And I said, "You still got it, right?" He said, "Yeah." He said, "Well, when I get the shot, it lasts for like a couple months. I feel good, and then when it starts getting bad again, I go back." I said, "I have someone that'll give you a shot, and you'll never have a migraine again." Nah, yeah, everyone's got. I said, "Here, so I always make people deals. You know what a gambler says? Never bet on something you can't win." I said, "Here's the deal. You and your wife, and this whole golf course and their wives, not the whole golf course, just our group of 4. If he doesn't get rid of your migraine, you guys decide where we're going to dinner, and I pick up the check. wine, champagne, whatever you want, I pick up the check.
And you know Les don't pick up no check.
Wes doesn't pick up any check if he doesn't have to. In fact, you owe me a lunch, so I'm just taking
I don't
you out.
owe you no lunch.
Yeah. Your
How do
people-
I owe you a lunch?
Because we're still making up for that big lunch I had to pay.
No.
No, okay.
It's a different animal. But I got a question.
I love to have fun with him, Doc.
I got a question, Doc.
He's
I
my
have.
buddy.
I just came up. The women now that cannot have children. There was an operation done on Thursday.
Oh, you told me about that, yeah.
Uterus operation. And what they did was unique. They had computers fill in the difference from all over the world. They've been working on it for 15 years. And they put everybody's information into this computer, and they came out, and boom, boom, boom. But the point I'm trying to make here is everybody is endorsing this new procedure. And they don't even know if it's going to work. But then you come along for 50 years, and you've had a solution to many problems. And I'm talking about financially, saving the government money, insurance companies. I still don't understand this whole mumbo jumbo. And they won't look at what you do as different medicine because it's different from what other doctors do. So my point to this whole thing is, why is it that a uterus, which I know is important, and women can have children now that could not have it before, that's big, but why wouldn't you recognize something that Dr. Pannozzo does?
Well,
They can actually take
they
away
do.
pain?
Most insurance companies do. There are a few that want to restrict. You have to understand what goes on here. It's not the techniques that we use that are in question.
It's others.
It's how to restrict your ability to get medical care. That's what you're seeing.
So this is way
when
above
they
what you-
restrict your medical staff, you have to travel a little bit to get to those people. So if you want to come in and we're not on their list, then they don't pay, and you signed for it. So you got to really know what you're buying. These insurance companies are told by the federal government, this is Obamacare, to restrict access to medical care.
And what does that mean, Doc?
That means you can't find a doctor. That's
to
what
take
it
care of
means.
your problem.
Yeah. So if you do find it, they'll say, well, you're not on our list, so we're not paying. That is really, you got to sue the company for that.
Yes, that's not right.
Because they have no right to restrict anybody as far as I can see. It's a private company, but so what? The state of Florida is the one who recognizes your ability, not the insurance company.
Let me give a number out, Doc, in case people want
That's
to.
how I think about it, and you gotta fight with them. I mean, if you say you're well, you got to tell the insurance company, I don't care if he's restricted. He fixed me. You got to pay, or else you're going to lose me as a customer. They can't stand that.
Well, there's something else to look at. I would say most of these people that have insurance have to pay a 20% deductible. So if you're going in for a back surgery, and a back surgery is $100,000, you have to come up with $20,000, and there's no guarantee that surgery is going to ever work.
Right.
So let me give out a couple of numbers here, folks. 800-889-0267. That's 800-889-0267. If you have a question, you don't even have to give your name. You can just call up, and Dr. Pannozzo will be more than happy to answer the question if he can. If not, he'll tell you where to go. And I don't mean like where to go. He'll tell you who could give him the answer to that question. That's 889-0267. And New Yorkers, it's a free call. It's a 1-800 number.
Wait a minute. You just gave 800. Get the right number.
800-889-0267.
02? Okay. You just gave 800-0267.
Did I do that, Doc?
I don't know. I was thinking about something else.
Then okay, what were you thinking about? His mind is always going. Could you help Freddy, Doc?
I can't.
I know you've helped him, but there's certain things I want to know if a shot will work on him.
Well, the shot will work, but I don't know where to put it.
I'll call. Hold it. Hello, Linda. This is Les. Where should I put that shot?
Funny, Les. You talk. You manned up and you got one shot. And all
You're
that,
asking
now
me
you think
about.
you're all that.
You're asking me about why this uterus stuff is so.
Yeah, I mean, everybody wants to have children.
You
they
happen.
can't.
Well, it's sexy. That's why.
No, but if you're a woman and you can't have children, it's well embraced.
It's sexy. Don't worry about it.
But if I can't walk, I can't have children either because I'm in pain.
Can I have a uterus, doctor?
Yeah, we saved a lot of marriages.
I'm pretty sure you have.
Yeah, we take care of headaches. I mean, we save a lot of marriages.
Oh, let me. No, I'm going to send you to the United Jewish Center because all Jewish women complain about headaches. So I'm going to send you there, and we can make a fortune.
You know, that's Les Mayer, Mayer. You can send the questions and the comments to him. I get enough of it during the week.
Yeah, you don't know what I do. Okay, now here's something that, okay, you have a child that comes in with a mother who has scoliosis.
Scoliosis.
Okay, and she says, "Your doc, here is the MRI," and you look at it because you're very passionate when it comes to children with scoliosis. I know that about you. You're very passionate. In fact, you've even said if you can't afford it, you would help. So they're showing the MRI, and all it's showing is the curvature of the spine. It's not showing what's affecting that.
Yeah, you have to be able to know what causes scoliosis, and it's scar tissue.
So you're not born with scoliosis?
No,
Okay.
and it's due to injury.
Okay.
Now, most of the surgeons will think I'm full of baloney, that I'm not. This is absolutely the truth, and we act on it. I mean, we reduce the scoliosis that you have in a matter of minutes, and you can see it on the fluoroscope, which is a real-time X-ray. So you do it before, and you expose it afterwards, and you see the change right there in front of you. Now, what more can you want? Here's a Baylor University. They do 2,000 scoliosis surgeries a year. Can you imagine the devastation that's going on with these kids? And it's totally unnecessary. You don't have to do it.
I wish you could write a paper about that.
Why? Well, it'll never get published because it's against common knowledge, which they think is common knowledge. But
all that pain
the
and
curvature,
suffering, wow.
Their attitude is, we'll prevent it from getting worse. But that is stupid thinking.
I think so.
Truth. You have to think about improving it, not stopping it from getting worse. And we could do that, and we do it. And then they have the therapists involved in it, before and after. Here's the article. Before and after the surgery, you get all this therapy. You know what this runs into? In my office, I do all the work. You don't need therapy.
No.
We take care of it.
Yes.
You know, but there's money for operation, then there's rehab,
Yep.
and then there's time down.
Medicine's also for that.
Yeah, but there's time down. You can't go to work when you're in rehab.
Yeah, so Baylor University really is scamming the public. I think they ought to stop doing this. It's also, the hospitals in Florida, they ought to at least ask, what can we do instead of operations, but they won't ask that.
So let me ask you a question. So naturally, a mother hears a child has to go in for surgery for scoliosis. And what if the mother said, is there any other way that we could prevent that?
No, because their pediatricians are telling them they got to have this, and then they believe it.
I mean, you
but
could
who
go
are
to
these pediatricians to tell anybody? They don't know anything about it.
Well, I would tell
The
everyone.
orthopedic surgeons don't know anything about it. If they did, they wouldn't be doing those procedures that are terrible, absolutely horrible. It's bloody.
It's a cage.
Ugh.
And screws, and
It gives me nightmares when I think about it.
Well, then here's another question I want to ask. Why, whenever you go to an orthopedic surgeon, the first thing they say to you is, let's start with therapy? My mind is that if you have a pain somewhere...
Well, because they
hurt more.
have to line you up for the operating room, so it takes a while to do that.
Oh,
So
you mean
in the meantime, you go to therapy.
Yeah, all right.
And you say, well, why should I go to therapy? Are they going to help me? No, they don't help you.
No.
Well, the funny
If
thing
they
is,
did help you, they would not have the surgery scheduled in advance.
I know.
well, the other funny thing is that you have to
Very funny.
wait until an opening comes up.
Well, that's what I just said. You
Like,
got to wait
like
for
2-3 months sometime.
Yeah, sometime, yeah.
And then you throw a party. Hey, I'm having surgery. A friend of mine did that. She said, I'm having my hips replaced.
Oy.
And
Ugh.
she waited 3 months.
She's happy with
And
it?
she had the first one. No, and then after she had the surgery, she cried like a baby for 30 days. She couldn't take the pain.
People don't realize how painful these things are.
Very painful.
Oh, my God. And it takes you weeks and weeks, maybe sometime months to get over it.
And that's if it works.
And then somebody will say, well, I walked the next day. Well, you were lucky.
I know someone that's been suffering now for 3 years with a double hip. You know what I found
Double
out?
hip replacement. Oh, my God.
Double. Well, you know what I found out? He, you know the guy, but I'm not going to mention his name. He was in such pain he couldn't go to the bathroom. Okay, and what happens is you get so lethargic. All you do is sit and eat.
He couldn't go to the bathroom.
Couldn't even stand up. They had to get one of those.
Well, you know what that problem was? It's a ligament. All pains are due to ligament. If you know where it is, you can put a shot in and it wipes it right out, right now.
Why doesn't
And I'm not kidding.
Well, you know
And
what?
no one could do this kind of work because we pioneered it.
Well, you know what it is? They say do something good.
There was a guy who had a complaint against me, and I read that. And his whole
Could you get a more honest doctor than this? He's talking about someone had a complaint against him. What doctor would say that, Freddie?
The whole thing was that he thought that I was criticizing the surgeons, and he thought that was terrible, that I would criticize the surgeons. He wasn't listening. I don't criticize the surgeons.
No, you never do.
Never have.
They do what they do.
I think me and Les criticize them more than you do.
Yeah,
but they don't do what I do. See,
Absolutely.
That's the problem. You got to give it a chance. You got to at least get examined, and to know what your problem is, because you're not going to get it from surgery. The surgeon is not going to do it, and they don't do this kind of work. So there's no criticism of them.
No.
I don't care what they do, but they're not doing my work.
No, in fact, like Freddie just said, we criticize them more than you. You never criticize anybody.
We don't.
And I've been there.
Are you comfortable?
Yeah, I make a good living.
No, are you comfortable sitting? Can you sit up? You're out of
Oh, I'm
frame.
sorry.
You're on TV here.
Oh, I said, hi, everybody. This
And
is
you never
Les
told
Mann.
anybody how they could see the show.
Oh,
We're on TV.
Your
collar's off.
What do you mean?
That's
you
better.
You can watch today's show.
Where? Oh, on Pannozzo. That's PANNOZZO.TV.
These guys make me crazy. You know?
He's on TV, Doc. He's laying back like he's laying down.
We made him a star. That's the
That's
threat.
what it is.
I'm a
Big
star in
star.
my own mind.
You're a star in my mind too.
You know, you got to give a guy credit. I mean, I've seen him say to people, I don't think I could fix what it is that you have. I mean, he's an honest guy, and to me, what always amazes me is he does what no doctor has ever done. He finds the cause of the pain. Right away, they say, okay, the MRI shows that you got this wrong with your bone. Again, I'm not criticizing orthopods. I'm really not.
Orthopods?
Is that right? I can call them that, right? Orthopods?
Some kind of plant.
That's what I think.
Orthopod?
Orthopod?
Oh, you put a little stuff for the mosquitoes, and you grow an orthopedic surgeon. Okay.
Yeah, that's good.
So what happens is, I'm not criticizing. Why hasn't someone said, look, you know what? Maybe there's another way. Maybe if the orthopedic surgeons...
because they're not taught that.
Yeah, but understood to see you.
In the conferences that they do, they're not taught that. If you got to spend $10,000 to go away to Houston for a week to hear these guys, you're going to come out of there and you're going to say, well, I didn't hear anything about Pannozzo and what he does.
That's right. Who's Pannozzo?
Yeah, who is that? Well, I am probably the premier doctor in the world for musculoskeletal stuff.
You're also the pain whisperer.
The pain whisperer.
Can you imagine if you created something?
I whisper the pain.
Like you created something for the uterus, that you're the inventor of that procedure, or the doctor that has a hepatitis solution.
Oh yeah, I saw that.
And he sold it to the medical corps, and they're charging $750 a pill.
Wow.
And the vets should be getting it for free, but they can't afford it. And you're allowed to do that. It's craziness. But can you imagine if you created that stuff? Would they accept it then?
The vets should get everything for free when it comes to medical. Okay?
I understand.
God bless what they do for us. No, that bothers the heck out of me.
I know. Follow the bouncing ball here. What I'm saying is that if the doc were to create these things, you would be well known and recognized. But you have something as big as that.
Or better.
I mean, scoliosis is something they still charge thousands and thousands of dollars.
The only reason we have is that it's so far out and so good that they can't follow the reareasoning.
That's right. You make
Yet
it
they're
too
not
easy,
asking.
Doc, you make it too easy.
This hospital that's doing all the surgery in Boca or wherever they're from. I mean, no one's ever called me and say, can you give us a lecture on what you're doing over there? No. They're happy doing the $75,000, $100,000 surgeries and bankrupting families. And these kids have this for the rest of their life.
And that's,
I mean, you got to think about that, pediatricians. I mean,
now I got a text that came in. When they do the operations for scoliosis, Doc, they put them under anesthesia. Yes.
Oh yeah.
And a lot of people are allergic to anesthesia.
No, they're not.
Well, this is what this lady wrote in, saying her son was allergic to the anesthesia, and it almost made him go into a coma. So they had to stop the operation.
No, it's probably low blood pressure or something like that. You can't be allergic to that. They use too much of it.
But isn't that a problem?
No.
If they use too much of it?
No, what I mean, they use it everywhere.
Oh, you use it all the time.
In volumes. I mean, it doesn't have any effect like that. She was misinformed.
No, she's running out of the hospital. She's done with the hospital.
Well, what did she go there in the first place for? What did she
Because
expect?
she was apparently told to do this by a family
That's why
member.
we do the show.
A big surgery. Don't do that, ladies and gentlemen. Look at us look.
That's right. Here's an
us
alternative.
Up first.
Well, to me, this is just me. I think surgery would be the last thing that I would.
I would not
ever
subject my own child to that. I'll tell you right now.
And I would not take medications because I found out from a druggist. I was given a medication for I can't remember what it was for. And I went to the drugstore, and she looked at me and says, "Les, you can't take this." I says, "Why?" She says, "Because you're on Humira. This is bad for you to take, and if you want, I'll call up the doctor." Now, you had a patient that came in with pain. This is the way they came in with terrific pain. Remember those? You might not remember. These two ladies came. They saw the TV show. She came with such terrific pain from her head, and she said the pharmacist saved her life. The doctor gave her a stronger medicine, but didn't take her off the one that she was on now, and could have caused her a heart attack. But the pharmacist found that out. She came in to see him because I happened to be there just by accident, and she said this is the first time in her life she hasn't had a headache, and asked him if it's going to come back. You haven't seen it yet. It doesn't come back and never came back.
No,
and
headaches don't come back. No.
Because people ask me that. I said, I see a lot of his patients there.
And vertigo. We have virtually 100% cure rate. I mean, it's kind of hard to believe. Vertigo is not from the inner ear. Why?
Right.
Nobody ever gets better with that. You got to think, what is the... if you're treating the inner ear for vertigo and nobody gets better, there's something wrong with your treatment, right? Something wrong with the idea that you're doing. So we did research on that by accident, actually. And
talk to the Major League Baseball people who have more cases of vertigo on their athletes.
Well, why is that?
Well, it's funny. That's a good question because they don't seem to make them better.
I'm going to explain it to you. When you're going back like that, see, can you see all this?
Yes.
Your head goes the other way when you're right-handed, right? And then when you go through, your head goes the other way.
Correct.
So where is the problem? At the base of the skull.
Base of the skull.
That's right.
But they don't, Doc, I'm telling you,
they don't have adequate medical
they don't.
staffs. That's why these people are not getting their money's worth. If they'd come here, we'd fix them up really fast.
Well, we're not talking about a lot of money when you see him. I mean, my God.
There's a baseball player for the Marlins last year that had to sit every other game because he had vertigo. He used to run off the field, the same thing as the guy from the Twins. But in the minor leagues, when you have vertigo, they don't want you coming up to the majors. They don't want to deal with it.
I got one better than that.
That's true.
3 tournaments ago, Jason Day, who suffers from vertigo, was leading in the, I can't remember which one, it was a couple of months ago, was leading in the tournament, fell right down. And they didn't know whether or not to take him out and not be, and what happened was he couldn't see the ball the way, and his vision was getting into where he was seeing the aurora of the clouds over his eyes.
Angel
he suffers,
eyes.
Yeah, thank you. And he suffers from vertigo.
Yeah. That's the same thing that happened with the baseball play. He pulled himself right out of the center field. He couldn't play.
We're talking about a guy that's going to win $3 million.
So what happens to these people? They just
They
sit
go
on
to a
the
regular
bench?
doctor and he does what he has to do.
They put him on some kind of thing for the inner ear infection.
You know what, Freddie? All they had to do was take aspirin.
Well, Doc,
They took 4 aspirin.
For vertigo, really?
Yeah.
Wow.
All they had to do was come and see you.
Yeah, because we use an anti-inflammatory, which is aspirin is your best one.
Hey, I'm on a strong dose of Humira, okay, which is inflammatory.
Well, that explains a lot of things.
Yeah, it has nothing to do with
No,
it.
wait, I'm going to tell you the story. And Doc, don't interrupt. I'm a star. I got the board here.
Okay, tell us what the story is.
Okay,
What's the story, Les?
And I was going to, I forgot the story. Oh, I told him I was going to see Dr. Pannozzo, and I was going to get a shot. And I told him what the medicine said. He said, "Oh, don't worry about it. That's an inflammatory. That might make it even better than what you're doing now." Smart doctors understand what you do. Yeah, well, even though they're not in the field like the gastroenterologist, and you go to gastroenterologist and he says that medicine is nothing. It's an inflammatory. It's in and out of your system. They knew about it. You go to an orthopod, the guy that grows the plants.
Again with the orthopod.
See, it's an old medication. There's nothing wrong with
No,
it.
it is. They know
It's
it.
location.
Location.
That is everything. The location of where your problem is what I specialize in. This is what I do for a
You're the
living.
real estate doctor.
That's right. You're the
Location,
real estate man.
Location, very important.
Location.
Right.
And I watched what you've watched it. We've seen it on the fluoroscope, and it'll show the person. You see that scar tissue. Where's it leaning against? It's pushing the bone. I'm going to get rid of that. And they look and say, in their minds, they're saying, oh, this guy is a quack. And guess what? You actually see the freaking bone straighten up.
Yep.
What?
I take pictures of this because, and then show the patient, so they see everything, and then I take pictures of it with my camera, and I'm going to give them to Freddy to put it on the website.
Now, that's a good point, Doc. And ladies and gentlemen, you don't walk in with scoliosis and see Dr. Pannozzo for one visit.
No.
And say it didn't work.
No.
I still have scoliosis. I mean, come on. It's not going to work on one visit.
Why is that, Freddy?
Well, because there is a multiple area you have to grade
there's
into.
12 bones in the dorsal
That's right.
spine, and they're all out of place, all scarred down.
That's right.
That's why you get a bulge back there.
That's right. But it's not going to happen. Like, I have people come up to me and says, I went to see him, it didn't work. I said, you got to keep coming to see him.
But you got to see it place to place. Those people are very hard to deal with. Intellectually, you can't deal with people like that. You show it to them, and they still go out there and say, it didn't work. I mean, what do you want? You can't have something that you've had for 40 years be treated in one day. It's impossible.
Yes. It's going to take multiple.
Even for me, Freddie, even for me.
Even for you. Even for you. But Doc, you give a chance for somebody to have an alternative. Would you rather go in
if they
and
don't
have...
take it, they deserve everything they can get, is all I can say to you. You make a bad decision in life, and you're stuck with it. I mean, you got to be careful.
That's right.
And you know what people don't realize? People don't realize one thing. And this boggles my mind. If you could go in and get a shot that cannot hurt you, if you're on 9,000 medications for heart, for blood, it's not going to hurt you. The worst thing that could happen is it didn't work. Okay, you're going for major surgery. That's it.
And you're stuck.
You're done.
You're dead.
And if that don't work, you're in a lot of trouble.
You go for another surgery because you believe that, And you know what they all told me? The doctor said there's scar tissue. Oh my God. You've only been saying this for freaking how many years?
Scar tissue is everywhere. I mean,
it's every part of your body.
It's all ligament stuff, too.
Now, Doc, I was reading.
Now, once you get operated, your scar tissue is no longer the little piece that we're
It's a
talking
whole
about.
area.
Now it's everything.
Oh, really?
3 inches deep and maybe
wow.
4
I
inches
didn't
long.
know that.
A lot of swelling.
Oh, it's just horrible. And I have to deal with that, which I do.
Now, Doc, I was reading today that there are doctors that operate on tendons.
No, she never operated.
I know, but this is my question. They say that sometimes a tendon tears, and they have to put it back together. Can you do that? I mean,
no, that's a surgical thing. We don't do that.
not you. I mean, is that doable? Can you tear a tendon?
I don't think so.
And then they graft tendons, which is what Tommy John and all that other stuff is. They put another tendon, they graft it.
I mean, I'd have to see the proof that there was something wrong with that tendon. Just having the pain is not it.
Okay, so when people
You have to prove it.
So when people come see you, one of the questions I get asked a lot: stability of, let's say, the knee. They come to see you. They've been told, get that operated on, get it cleaned out, yada yada yada. You go in there, you take out the inflammation.
Clean it out.
Clean it out.
That's so stupid.
Yeah, I always say that. What does that mean?
It doesn't mean anything. It's stupidity, is what it is.
I do the same
They
thing,
tell
yeah.
an athlete all the time, you got to clean it out.
And I never know what that
clean it
means.
They take the syringe and they take the blood and the stuff that comes out of it.
It's all make believe, all of it.
But stability of the knee, after you take out the inflammation, he rests up maybe a day or so, he comes back. Is that knee stable?
Yes.
And it can do the
The only
things that
reason it's unstable is because it hurts. So if you take the pain away, it's now stable, right?
We have a friend of ours.
And you don't need rehab with all that exercise and whirlpools and all that other bull. It's just bull. It's all a periphery of the joint, and it's all the ligament structure, which is painful, not inside the knee. So you take care of that, you got a normal knee there.
You know what you just said with the whirlpool? When I first got the pain in my groin, no, but this is true. I thought if I sat in my jacuzzi with the hot water and relax it out, I did that on a Sunday. I was at his office Monday morning. It didn't do anything.
You went into I think you went into a jacuzzi for a different reason.
I was not with other people.
Yeah.
It was just
I'm pretty
for me.
sure. But no, that's not gonna work. No. And it's funny because when I was in sports, it was the race to the ice tub.
Oh, God.
Oh,
You
God,
had to sit
yeah.
for 10 minutes
Worst.
or 8 minutes.
I don't know the reasoning for that.
Because
listen,
it reduces swelling.
I'm taught all this, right? I'm a regular medical doctor. We taught all this.
Right.
Use ice, use heat. Baloney. Nobody knows what to do. I would not use either one because the body will produce an influx of fluid to repair an injury. Now, if you put ice on it, you're not getting the flow of nutrients there, are you? So why use ice?
Well, let me ask you a
If
question.
you're using heat, you're
Well,
getting
hold
too
on.
much.
Let's stay with the ice for a
you
second.
don't need it.
Let's stay with the ice for a second. If I put my ankle...
He's persistent, isn't
Oh,
he?
yeah, you ain't giving up.
Doc, I did this for 22 years. I played sports, and I used to ice up. If I put my
And you
foot...
haven't learned anything yet.
No, I learned a lot. I learned not to play any more sports. So if I put my foot in a bucket, does it reduce the swelling?
Well, I got my foot in a bucket.
It will, but why do it?
Okay, but if I do that,
It
and
doesn't
then
help you.
it's all stiff and everything.
Yeah, it doesn't help.
The pain still comes back.
Yeah, the pain's there.
And then the inflammation comes. It swells up again.
Yes.
Okay, so why do we do it?
I don't know.
I don't know why you do it. Listen, I'm trained that way. I'm the doctor.
No, and then they put the heat stuff, the bomb. They used to have
That's
something
worse.
called Tiger.
Uh,
This thing will melt your skin. But you used to take the Tiger to loosen up what the ice just did to you.
yeah, see, there's no rhyme or reason to that. And how do you get the tiger? What is that? Something
Tiger balm.
You put
Tiger
on
Balm, that's the one. Yeah, I heard of that.
You put on the skin, right?
Yeah.
Yeah.
Okay, well, how do you get it into the injured area?
It's topical. It's on top of the
It's
injury.
topical. You can't get it to the injured area. That's
No.
why it's useless to use
And
that.
it smells horrible, Doc.
Yeah, well, that Tiger Balm smells like, woo.
So what's
and
the
the
deal?
other thing is you don't restrict motion.
Yeah, they did restrict motion. They used to
Yeah.
tape up.
Yeah,
knees
don't
and stuff.
tape it up. Don't have them move it, and the more you move it, the better it gets. And what we do is we just go with our steroid, find the injured area, inject it, and kind of knock it right out.
And you know what you said to me a long time ago, I still remember. All the guys that wore belts when they lifted weights have pain.
Yeah.
You know why? What you told me, you're not giving that part. I'm the only one in the gym that never had back pain, thank God, because I never wore a belt. Because I'm
But you don't
limiting-
lift any weights.
Oh, I never lift heavy. He told me, why do I have to lift heavy weights? I'm not going to be a bodybuilder. I lift weights. I do my 8 sets. He said something one day. He said, let's only do 8 sets. Make it heavy enough where the 8th set makes you a little tired. All my guys are doing it now at the gym. They're not doing 12 anymore like they were taught because it's only going to put, that's why you don't tear anything. But he knows this stuff. He owned gyms, right?
I did.
You owned Bob's and Tom's also, but you also own gyms. I snuck that in. She's the only one that understands what I say.
You follow any of this? He's
I
had
have
too
no
much
idea
coffee.
what he's
I
talking
think-
about.
I don't know.
Oh, this
either.
coffee is killing me, Doc.
Did you know what he's talking about?
No.
I have no idea.
Getting back to real life, he has a patient that I brought in who went to Denver to the top knee surgeons in the country.
In the country.
And you know what?
Yeah.
And am I right?
Yeah.
And guess what? He's curing them. This guy couldn't play tennis.
Because it wasn't a knee. He lost his knee. You
He
see,
took his knees out.
the knee wasn't there. and
But
he's-
guess what was there?
And he's having pain now. And
Scar
I said,
tissue.
well, it can't be your knee. You don't have it.
Right.
So it can't be the metal, because that's what you have. So it has to be scar tissue. Now,
And-
where is it? It was under the patella. See, when they make an incision like that to go right through the kneecap and pull it off, and it scars down when they sew it back on. And that's where you have all your problem. But there's no surgery for that.
And know what's amazing, though?
And you think those guys would refer him to somebody like me?
No.
No, they don't.
But here's the beauty. The guy's playing tennis again. This is not a young guy.
You know, we should have taken that guy and tell him to go back to his doctors.
He was going.
I want to know what they would tell
Wait,
him.
he was going back until I said, Jim, just do me a
I
favor.
understand it, but I would have
Go
gone
see
back
him.
after he saw Dr. Pannozzo. I'm dying to find out what they would tell him.
They would tell him that they have to revise the knee. That's
Yeah.
what they would do.
Another operation?
Another operation.
Clean it out and
Yeah, clean it out.
Right.
Yeah, the meniscus surgery is always, we're going to clean it out. And
Oh, yes.
they take all the meniscus off, so you got a gap in there.
I didn't give the number for that reason.
That's okay. They could call the doctor.
You got to call me back.
Well, you got to tell him that.
Oh.
Hold it, Doc.
All right, so let's talk why he...
Okay. What happens is you being a coach was the most amazing thing.
Dr. Pannozzo, you got to call me back.
Because what this guy did, which is amazing, he said the best thing I ever did to him. He wouldn't believe me. He wouldn't believe me until he saw the guy. This guy now plays tennis, which was a sport he loved, and he's going back to playing golf because every time he would swing, he gets such pain that he... And he was scheduled to go up there to Denver again to get 2 new surgeries. And he said to me, best thing, Les, you don't know much about lifting weights, but you really know.
The more surgery you get, the more scar tissue you get, and that is your enemy. Don't do it.
Hey, Doc, I got a question. All the hits that I've taken as a catcher, body slams and everything else, my whole body feels like it's inflamed. Can
You're
that
a
be
catcher?
real?
I thought you were
I was a
No, he's a catcher.
wrestler.
I wasn't a wrestler, Doc. I was a catcher.
He only wrestles at night with Linda. Bada-bum-bum.
Big.
Can my body have inflammation all over the place?
Well, a
No.
body like yours, it's...
I mean, it hurts everywhere,
No,
Doc.
it doesn't hurt everywhere, no. These are
Doc,
specific.
don't tell me it doesn't hurt everywhere. I get up, it hurts everywhere.
There are specific locations that are treatable.
Is it all coming from my head, my spine, my
all,
legs?
all kinds of structures. They're all ligaments.
And everything crunches when I get up. It's like, I feel like a crunch bar.
It's actually it's a 4 or 5 level of your spine between the 4th and the 5th bone that does a lot of that.
Really?
Yeah.
Ladies and gentlemen, I'm going to go see Dr. Pannozzo to get my 4-5 fix because I'm going to tell you, Les, as you get older,
Do you think?
with the cold weather that we had in Florida the last couple of days,
My groin's okay, though.
is it?
Oh, yeah, ever since I saw him, man.
I'm going to take your word for it. But I get up and I crunch like a crunch bar. And he says 4-5. This is what I mean. You make it too easy, Doc.
Well, why
You got to say, well, we got to go on to further testing.
No, what we're going to do is you're going to come in and I'll do I'll shoot. Do you want him doing
What do you mean you're going to shoot me?
the procedure?
The difference is I know where these things come from. I worked them out over the period of years, and those who don't do this kind of work will always get an MRI, and that's your worst thing you can get, because who's reading it? The guy who doesn't know anything about a backache.
But the problem is also they're only seeing the bones and not seeing what's causing the pain.
And you have to interpret a lot of
ridiculous.
stuff. That's why when we do a standing picture like that, it's patented, and it tells us a lot of things that you have to know. It's an engineering study. And pain, failure to bear weight is a physics problem. See,
And
that's what you're having.
And
right
stretching.
Well, think about this. If you're over the age of 50 and you get up in the morning and, you're all crunchy and things hurt your body, there's a reason. I mean, he just gave me a reason for this, right?
Of course.
Do you know how many people are in my position to get up?
More than you could imagine, my
I
friend.
mean, I'm not like Les that goes to the gym every morning, or so he says. But you get up and you're stiff and there is pain.
I get
it's
up, I'm
everywhere. Yeah, I'm pretty sure you do. And there's pain everywhere.
Well, you have an engineering problem there, too.
Listen, I'm an engineering mess, Doc.
Yeah, because you had...
I'm
Don't do that when I'm drinking coffee.
I'm an engineering mess. Doc.
When people hear me talk about an engineering problem for causing low back pain, they'll say, what the hell is this guy talking about?
Yeah.
Well, it's actually, you can break it down to that, because you have to have a source of the pain. Why do you have to have a source? Because you can't get rid of it unless you have it.
That's right.
And we get rid of it that day. See? That's what this reality show's about. Now, if the guy listening from New York would hear this, this is one of a kind in the world. Nobody else does this kind of work.
That's true.
Is that amazing?
And it's true.
You would think that an orthopedic surgeon or
Said it again.
no, I was going to say or a chiropractor, which I don't know what they do to begin with, would at least say, you know what, I want you to see my friend. Let's see, maybe you don't need surgery, and you go to and you fix them. That should be good for everybody. Because now you have a patient that says, well, I went to Dr. whatever his name was. He told me to see this guy, Dr. Pannozzo.
The federal government got the insurance companies to restrict some procedures on the joints around. There's a lot of joints in there also. And to restrict the treatment of those joints, which is really kind of dumb in the beginning, because there's only an annulus, a ligament, and a joint capsule, and that's all there is. Rarely do you get a nerve involved. So you only have these two things, and the way they're set up for each other is why you have a pain, and that's what we tell you on the scenario portion of the treatment. And it is true. Why? Because now we have to perform on that. So right then and there, we're going to say, we're going to take this pain out. It takes da-da-da-da. And if you want to do it, and they say yes, we go right to the room and do it. And then on the 32 feet walk, that pain is leaving. And when they get to me where I'm writing the record, I say, make it hurt, and they can't. What more truth do you want? You're seeing it from the patient themselves.
That's right.
We don't make anything up. This is all from the patient.
And you know what? If you have nothing to do one day and you're in a lot of pain, and before you go in for surgery, or why just walk into Dr. Pannozzo's office at 16244 Witten Boulevard, just Suite 740,
Military
Trail, and just listen to the patients. You don't even write your name down that you came, and just listen to the patients. I mean, there's nothing better than word of mouth.
And they can watch you on the TV.
And you can sit there, watch me on the TV, and say, God, what a good-looking guy. I wonder if he's married. And they're talking about you, by the way. And
we could buy foam bricks so that you could give it to your patients. They could throw it at the TV set.
No, what? There was a guy that comes in. You ready for this? He comes in and waits for everyone to leave. Dr. Pannozzo calls him and he says, he's watching the TV. He sits there and he laughs and says, this guy is great. And it goes like this. I defy anyone. I said, I'm a patient. I defy anyone to tell me that what this man does doesn't work. And that's a patient.
Yeah, me too. I defy you.
Yeah.
I defy you too.
Because we do it by re-exam. So that's the secret there.
Okay, folks, let me. Whoever's calling Dr. Pannozzo on the phone, we got another call, Doc.
This is what happens. Well, I can't answer that.
No.
This is what happens when you go to chiropractor. You see this?
Mm-hmm.
I have no idea.
What is that?
Who knows?
That's a wall chart they always have. That's about 10 feet tall.
This is to convince the patient that they know what they're talking about, which they don't.
Well,
you don't need this kind of stuff.
That's the electric.
Okay, I'm going to give you
here's another one.
Okay, yeah.
And they present this to the patient, and by the time you walk out of there, your head's going around like this because you don't know what they're telling you.
Okay, you brought up. I want everyone to go to this website. It's capital EDZARERNST.com, and what that is
what is that?
It's a chiropractor who went out of the profession because here's what he said. He said, cracking of the spine doesn't mean much and can cause many problems. This is not me talking. He said, unless the diagnosis is done by a professional physician, MD, do not believe.
Let me read you some of these impressions from this same guy.
Okay.
I better put my glasses
on. Oh, got him.
Now, this is the impression now, the diagnosis. Presumed projectional distortion versus anatomic variation, including lucency at the base of the dens, presumed MAC effect. Double floor sign, presumed projectional distortion, and elongated C2-3 articular pillars, likely the result of chronic altered biomechanics and subsequent osseous remodeling. Can you follow that?
I know where it is.
I don't understand a word he's saying.
I want someone to let me read this.
Listen, I've done this all my life. We've done 70-some thousand patients, and I don't know what he said.
No, I don't, and I told you.
Presumed projectional distortion versus anatomic variation. Come on.
That's known as minutia.
That's no diagnosis.
Minutia.
Moderate spondylosis throughout the cervical spine. That's not a good diagnosis.
No.
Moderate facet osteoarthrosis throughout the cervical spine. That's not a good diagnosis. Where's the localization?
Well, here's one doctor. Here's what you said. Their legitimate scope is very narrow. They're limited to narrow ailments, chiropractors. And they really don't cure because they do not know what's causing the pain. And cracking of the neck, according to this doctor, not me, can do more harm than good. Watch any James Bond movie. They crack the neck, the guy's dead.
All right, now what's missing from this?
They don't know where the cause of the pain came from.
They don't know where it is. They don't know pain pattern.
No.
They don't know structure, causes.
And that's the thing that you know is pain pattern. You're also a physics major. So aside from being a musculoskeletal specialist with a degree from, an MD degree from Ohio State.
In other words, people should understand what this program's all about.
To help you.
This is to protect you from people like him. Mm-hmm. You're not going to get better there.
No, according to this chiropractor who studied and just decided now.
That's an article, but I'm reading you an actual case here. You're not going to get better like that.
No.
There is no localization of your pain.
So,
now, when I saw this woman, We took that pain out the same day. Why? Because it made sense on the exam, and we knew where it was
Found
from.
where the pain was coming from.
And what did she tell you?
And she said, "I feel better already."
That's amazing.
It's just it's.
I hear
smart,
that
though.
all the time. Every day I hear that, all the time.
Well, the beauty of it is that you could, when you actually can cure the pain. Let me give you the number in case someone doesn't know it. It's
It's 561.
It's 561-381-5800.
They're calling that.
Yeah, I know. I would appreciate you could call at
Call at the other number. Give them the other number.
Okay, it's 800-889-0267. So if you're trying to reach
Call
Dr.
that.
Pannozzo, you could call him at 800-889-0267,
Yeah.
or you could call him at his
Call
regular
that
number.
one, yeah.
And, tell us what's wrong with you. I mean, maybe you went to Dr. Pannozzo and he didn't help you. Let us know. We want to know everything. We want to know if he helped you, if he didn't help you, and explain what he did or didn't do that you're upset about. We have that challenge. It's always open to anybody. We have no filters here. We take the phone call and we'll answer it. Don't even give your name if you don't want to. Call them up. Have you ever been questioned about what you do in all your years, like saying that this isn't what you're doing is
people
not right?
call me up on the phone. They want to know what I do. I said, "What do I do for what?" I mean, you got to be. This is a legitimate office. You got to have a history. You got to have a clinical
Well, I've been going
exam.
to
You got to have films.
I've been going to a doctor for 10 years, and he's never helped me.
Yeah, well,
What makes
that's
you so different? You guys wear the same white coat.
Okay, let me give you an answer to that. If you go to a doctor more than twice and they cannot fix your problem, go somewhere else.
You're in the wrong office,
Right.
including mine.
Yeah.
I have it on my wall there. You
Yeah.
read that when you come in. You say, "Well,
Hey, listen, Pannozzo also sponsors a show during the week. We had to get that leap in, jump out, jump in, leap out.
Oh yeah.
Saying,
You could listen to Dr. Pannozzo's, depending on how busy he is, on Two Boys from Brooklyn on 12:30 a.m. We talk about Dr. Pannozzo all the time, and if you want to talk about something, you just let me know. We'll talk about scoliosis, migraines, or whatever there is, because we want everyone to know there is an alternative in pain.
That's right.
You don't have to suffer. To me, there's nothing worse than pain. I had pain in my neck for almost 10 years. I got rid of my first wife.
You've been a pain in my neck for more than 10 years. All right, you want to do some questions? We got about...
Yeah, well, let's get some good questions. Let me take care of some questions here, Doc. Gentleman lived in California. It was Erica from New York, and she writes that she lives in California. She sent her mother to see you, and the main thing that she wanted to know is, I'm 34 years old with no children, and I'm suffering from scoliosis.
yes, that's treatable."
And
Okay.
what's the question?
Especially at 34, because she's young.
She said, I cannot see, I'm sorry. You can fix the situation without surgery. I'm 34 years old and single with no children. I cannot see myself living a happy married life with this condition.
Yes,
I have a
she's
huge
not married.
Tell yes, just
Yes.
to come in. We can treat that.
You could call up Dr. Pannozzo.
Another question?
Yeah, I'm sorry, Doctor.
What is he?
Not
He's
going to-
flustered?
not-
That's
not-
what you get for reading the questions for the first time now.
Okay. Robert from Atlanta writes, I have heard your show and gone to your website, but wanted to ask. I went to the dentist for TMJ and thought the $650 gizmo he made me buy would remove the pain in my jaw. It's worse than ever, and I want my money back.
What's that?
That's exactly right. That those
What is
braces make you worse.
Yeah, put something
is-
in your,
what
it's-
is
you
that?
put something in
It's
your
something
mouth.
in your mouth that keep your mouth open as you sleep.
Are you serious?
Yeah. Now, I don't know about
For
anybody else.
TMJ?
Yeah. When I first, maybe 15, almost 20
They
years
charge
ago.
like $1,000.
Yeah, it's very
So
expensive.
he got a discount of $650.
Yeah,
He
he
said
did.
gizmo. He put a $650 gizmo.
Gizmo. Yeah, because I don't know about you. Could you sleep at night with something like that in your
No, you
mouth?
can't.
That's
No.
craziness.
It
No,
doesn't work.
It's bad thinking, too. You never want to restrict motion of a joint,
No.
which is what this says.
I learned that from you. Okay, we got an Atlanta one here. Wilma from Atlanta writes, I hear your show 3 times a day for the past 8 weeks and think you are funny and, most important, very knowledgeable. You explained how knee pain can be something simple to fix without surgery. We are saving money to send my son down to see you because he can't work anymore with his knee pain. He was told that his ACL needs to be operated on.
ACL
No,
question.
no such thing as ACL.
Well, I got a question here, Doc, from Greg from Coconut Creek. Hey, Greg, you're on with the doctor.
How you doing, Doctor?
Good, good.
I listen to you about you all the time from Leah, from the Love
great.
Doctors.
Leah's a good friend.
Yeah.
Oh yeah, I have a question for you. See what you think of what type of doctor I need to see. I do working out. You know, I do a lot of that boot camp crap and all that. Probably about 4 or 5 months ago, when I was jumping a wall, after the fourth time at the end of the workout, I was very tired, and I caught my arm on the wall, and I twisted my arm real bad. The pain was mainly down through my tricep, and then over a couple of weeks' time, as I rested it, the pain would be there. It didn't hurt to touch it. You could hit me in the arm, and there was no outside pain. It was all inner pain. The pain would throb all night long. Finally, I went and had x-rays on my shoulders. I thought maybe I did something on my shoulders, so I went to an orthopedic surgeon, one that has worked with my son before when he had a torn ACL. And he gave me he did x-rays and found nothing wrong with my shoulders as far as the x-rays goes, what he said. And he did give me a shot of cortisone in my shoulder for the pain that was in my shoulder. That went away, but the pain in my tricep.
Okay, let me tell you, you got to chase this kind of pain down. And x-rays are not the way to go for diagnosis.
Okay.
You have to be examined. And then you got to know what the anatomy is to examine you. Yeah, we do this all the time. It's very fast treatment. So if you, take a chance, come on in, let's take a look at it.
Okay. It sounds like something you can take care of, the pain going down the tricep?
Absolutely, yeah.
All right, because he did give me a shot of cortisone in the muscle, in the back shoulder muscle. That didn't do a thing. If I move the arm very quickly, the pain is excruciating going down that back of the arm.
Right. The surgeons do, and they do surgical diagnosis.
Okay.
Excuse me, surgical diagnosis, which is not the same as what I do. We do anatomical diagnosis. So it's worthwhile to do it.
Yep. You can call the doctor when we're off the air. Would you wait till I give the guy your phone number so he can call you? 561-381-5800. Thank you so much for calling, Greg.
Thank you. All right. Thank you.
I can call you. Okay. Jessica from Boca Raton writes, I hurt myself in a car accident about 4 years ago, and my hip has never been the same. I went to the doctor, and he gave me pills and stimulatory to move the pain. I don't know what stimulatory, I guess.
Stimulus.
No, it's just
stimulus. That thing that vibrates. What is it?
Those. Yeah,
it's a scammer is what it is.
I've noticed that over time my hip seems to be getting worse and want to know if the procedure can help me remove the pain in my hip. Is it normal for this pain to linger this long and now it's in my hip as well as in my heel?
No, it's not healing. It's 4 years is a long time.
No, it's probably from the lower back.
Lower back. You see, and everybody's giving you something for the hip and they're in the wrong area again.
Well, I've seen him do it with Lee. I can't ask any more questions, Doc, because it takes me 2 minutes just to read the question. I'm saving them for next week. I want to give people a chance to know that you'll be here next week to answer some more questions. Are you okay?
If everything works well, I should be here. Otherwise,
well, if it doesn't, I'll give you a shot.
That's right.
So if you want to speak to Dr. Pannozzo, if you've enjoyed the show or you didn't enjoy the show and you want to speak to Dr. Pannozzo direct, he answers all his calls at 561-381-5800.
Yeah, complaints too. We don't care what you call about.
Clear your throat. Sounds like you're sick. I'll have to give you a shot when you get back.
Well, it's the weather.
It's the weather. Yeah. So they're going to be calling Dr. Pannozzo. That's okay. That's okay.
Take the call, Doc. We're almost off the air now. Yeah. So go ahead.
So Les, it was another wonderful show.
Hey, Freddie, thank you so much for everything. I appreciate you bringing your knowledge of sports and the people that you deal with.
Well, he's a remarkable individual.
He's the most amazing. I mean, you went to him. You sent your son. You know, here's what I always say. You're sending your own flesh and blood to see him.
That's right.
Okay.
And he's happier than anything else.
And he's a happy guy. And
sounds like it come out of the Bible.
Who?
Yes.
Oh, no, Freddie, I mean, the one thing you can know about Freddie, if Freddie tells you something, it's true, because Freddie can't make up half the stuff that he says, so you know it's definitely the truth.
It's crazy. It's a crazy life I lived.
Yeah.
All right, we've got 1 minute. You want to give out his numbers again?
Yes, it's 561-381-5800. This could probably be the best call for you or your children or the children that got hurt in sports, because this gentleman really can help you.
That's right.
Doc, I want to say again, it's always a pleasure working with you and being a patient. Freddie, Carol, thank you so much. And for all the people in New York, Atlanta, Boston, around the world, thank you for letting us spend some time with you. Have a great day.
It was very enjoyable. I hope people learn a lot. And we'll listen next week. Thanks.